Good morning, everyone. We are a special interest group which caters to the patients of diabetes with oral diseases. We are based from JSS Dental College, JSSDCH. We will now orient you on the importance of oral hygiene in diabetic patients. Now, what is the aim or objectives of our group is that we diagnose, treat, follow up, conduct several research studies which are still ongoing, some completed. We aim to reduce glycemic levels through our oral treatment, reduce economic burden that a patient would be spending by getting admitted or due to the complications that come by diabetes, by intervening at a pre-diabetic stage and also at several stages of diabetes by doing several oral treatments. Now we have opened a diabetic oral care clinic. We have 2 units, one in the Department of Periodontology, JSS Dental College and Hospital, Shivratrishwara Nagar, Mysuru. The other is based at the Department of Dental Science, JSS Multi-Speciality Hospital, MG Road, Agrahara, Mysuru. Now, what are the types of diabetes? We all know that we have 3 types. Basically, we have the type 1 diabetes, type 2, and the MODI. Diabetes basically is a metabolic disease with a hyperglycemic state. Several signs and symptoms are classical of diabetes, which includes polydipsia, polyuria, polyphagia. But what happens is when we have uncontrolled diabetes, there are various complications like kidney disease, cardiovascular changes, impaired wound healing. This includes periodontitis treatment or any other treatment where wound healing is the criteria. Gum disease is also considered as the 6th complication of diabetes. So I stress, gum disease is something that is considered as the 6th complication of diabetes. It is given as a warning sign in some literature, that is in research, that we can diagnose diabetes in patients who are undiagnosed with diabetes. That means we can refer those kind of patients to physician and come back for a review or for oral treatment or follow-up. So it is essential, remember, whenever you have gum changes, to visit a dentist or a physician. Now, what is the prevalence? Where all do we see in India? We see in all parts of India, and it is at the age group of 20 to 79 years, and it's around 8.9%. And the total diabetes cases in adults has reached 77,005,600, and it is expected to reach 100 million by 2030. That is a lot, a huge amount. Now, diabetes is a global burden. That is the bitterest truth for us as Indians, because we're spending around 90.32 billions in the management of diabetes. That was way back in 2015. Now, what I would like to introduce you to is about diabetes, the oral changes, what all to look for in your oral cavity, the relationship, and how do we go about planning treatment. Coming to the clinical signs and symptoms, that is what would happen to your oral cavity, what could be the oral changes within you. Now, this is basically a picture of tooth and supporting structures. That means the tooth is in place with the help of the fibers, which we call the periodontal ligament, which cushions the forces, the gums, which is called the gingiva, the cementum, which is the covering of the tooth root, and the bone wherein the teeth are housed within. Now, what are the oral lesions? First, you have the gum disease, which is the 6th complication, I stress again, which we call gingivitis or periodontitis. Dental caries, which is also very common, that is classically seen as a hole in the tooth, which some patients come by and give that kind of complaints. White lesions within the oral cavity, which is we call as the candidiasis. Black hairy tongue, the bald tongue, taste dysfunction, salivary dysfunction, burning inside your mouth, which we call the burning mouth syndrome, angular chelosis, alterations in microorganisms. Now, this is a picture of gum disease or periodontitis. So whenever you have some bleeding on brushing or spontaneous bleeding, make sure you see a dentist almost immediately. Periodontitis again is listed as the sixth complication, and this is of course by research. There could be other gum changes, that is like severely enlarged gums that you can see in these pictures, gum swellings with pus discharge, loose teeth, the tooth movement from the normal positions, recession of the gums from its normal position to a more up position down or up compared as your upper or lower teeth, bleeding from the gums, which is classical. And since there is going to be some amount of supporting bone loss, there could be mobility of tooth also. Now, this is another picture where we see in poorly controlled diabetes, many carious lesions. You can see it on front teeth, upper teeth, back teeth, etc. This is a picture of bald or atrophic tongue. You can see that it has gone bald there. This is a picture of white lesions, and this is called as candidiasis. Here you can see that there are lesions on the upper arch, on the tongue, and several other areas on the cheek region. Now, this is a picture which shows there is a cracked tongue because of diminished salivary flow, and a picture of black hairy tongue where you can see some black lesions on the tongue. Angular chelosis, where you have redness, ulceration of the corners of the mouth. Changes described are less common in well-controlled diabetes. That means we don't see these lesions if the patient is maintaining oral hygiene really well. So that means there is no incidence of caries or other clinical changes. You have to keep your oral hygiene well. And there is normal defense action. So what happens during infection is our host cells within the blood cells, they act into, they migrate into that area and produce certain chemicals or molecules which destroy the microorganisms. So basically we have normal defense against infections. Now, what happens in juvenile? Basically, we mean juvenile at a younger age group, something like insulin-dependent diabetic patients who are diagnosed at a younger age. So they have extensive gum destruction or periodontal destruction. In this picture, you can see that there is tooth migrated. We call it pocketing within the gums. So that is there. Gum recession is there. Now, this is a very young patient where there is severe disease at a young age. That means this is a radiographic picture with extensive bone loss. So these are a classical feature. Now, we say there is a two-way relationship between diabetes and oral disease. Why do we say so? Basically, when there is infection, there is altered cellular response, impaired tissue response, and altered collagen. Collagen basically, when I mean the attachment of the tooth root to the bone, that is what is called collagen, or within the bone, that helps to transmit forces. It cushions your teeth. So proteins and matrix molecules so what happens when there is infection? There is matrix molecules release, proteins release. They undergo non-enzymatic glycation end products. So there is an increase of these products, which we call the AGEs. So these periodontal tissues are more susceptible to infections. So whenever you have hyperglycemia, again these AGEs are increased, which again causes changes in the oral cavity. Any change in the oral cavity due to bad or poor oral hygiene, where there is microbes which are increasing within the dental plaque, which forms on the tooth surface below and above your gum line, that also releases a lot of glycation end products entering into your systemic circulation, causing hyperglycemia. Now, what do we do in JSS Dental College and Hospital, or in the dental wing of JSS Multi-Speciality Hospital? What kind of treatment do we want to give? So there are three things that we would be doing. We would classify you patients as pre-diabetic, controlled diabetic, or uncontrolled diabetes. So all patients would require oral screening. In uncontrolled diabetes, we would additionally have physicians monitoring diet counseling, treatment to reduce blood sugar levels within normal limits. Of course, we would also do oral screening. And in pre-diabetic stage, we would intervene, give them give you all oral hygiene instructions, your education, motivation, dental treatment wherever it is required. Supposing there is bleeding of gums, we would have to do cleaning of teeth, and caries teeth needs to be filled, or root canal treatment has to be done, or any candidal lesions has to be given some kind of treatment. Then you have other lesions that I mentioned, oral chelosis and things like that, where dental treatment has to be prescribed, monitored, etc. Now, in pre-diabetic stage, oral hygiene care is very essential in all the three phases. And dental treatment aspect can be done in pre-diabetic patients in controlled diabetes, but dental treatment under uncontrolled diabetes has to be done under physician's monitoring only. So this is a table where we have essentialized physician monitoring, where we reduce blood sugar levels, and treatment is done only after blood sugar levels are controlled. Now, what oral hygiene care you should be taking care of? Brush twice daily, use toothbrush, toothpaste, correct brushing technique. So you visit a dentist to learn that technique. Use only soft bristle toothbrush, never brush horizontally or in a scrub technique. Rinse your mouth each time after each meal. Use only soft bristle toothbrush. Interdental brushing as specified by dentist. That means when you have gaps in your teeth. Regular flossing, that is the thread that you use to clean between your teeth. Change toothbrush once in 3 months, and as well tongue cleansing. So remember, dental treatment is not a total contraindication. We will have to intervene, and we will do the treatment once your blood sugar comes under control. We would like to intervene in your pre-diabetic state so that your blood sugar levels are not going higher, and you don't have to go for other kinds of interventions or complications. Now, we are undergoing research in JS's Academy of Higher Education and Research, where we have completed on oral lasers in the treatment of diabetes. That is also one of the protocols, photodynamic therapy of oral lasers in diabetes. And we have also concluded that glycosylated hemoglobin, that is one of the parameters which tells about your blood picture in the past few months, that it reduces after gum treatment. And there is improved glycemic status. This is based on our research that we have conducted in our academy. Of course, if you are interested in undergoing or volunteering for any research protocols, you can meet us at one of these wings. Now, since diabetes has a huge role to play in COVID-19, since COVID-19 has also become quite huge for all of us to handle, there is difficulty in controlling diabetes, and there is increased prevalence of diabetes too. So I mentioned that even if you are in your pre-diabetic, diabetic, or uncontrolled, or you have any of the features that I have listed, do visit us at one of these wings. We are at both the wings, so visit us and make use of the best facilities here. Thank you. If you have any doubts, please contact Dr. Anitha Subbappa or Dr. Sunit Shetty at JSS Dental College, or at the dental wing of JSS Multi-Speciality Hospital. Thank you.